essentially what we're going to use the whole month of December discussing different stimuli of sexual pleasure and how much of that can mean too much. This week we're going to talk about pornographic addiction. As any form of addiction, there's always controversy. There's controversy whether it exists, doesn't exist, and then also whether the scientific and clinical community actually accept this as a clinical condition. Many studies show that there's a prevalence of people actually watch pornographic material. For example, it is estimated that 17 to 20% of internet traffic actually derive from pornographic streaming. And many studies done in the US, for example, college students of 9,200 and more students were actually analyzed, and it's noted that 17% of them noticed them to be addicted to porn. And the similar studies has been echoed in various parts of the countries, such as European countries, that can range between 8 to 17%. So what happens in the brain? In fact, it all started with any form of addiction. It all started with that attraction, and then that compulsion, that stimuli that actually carry on giving you the reward in the brain. And that compulsion itself will lead to tolerance, because you're wanting more and more and more, and that tolerance will eventually lead to desensitization. So, does that really hurt anyone? Well, if somebody's addiction to pornographic material actually is desensitize themselves or dissociate and distance themselves in a relationship, of course that will affect the relationship. If they themselves are addicted to porn and then they actually not engaging in any relationship at all, and later on they will find probably relationship very difficult. And that sort of expectation to have a similar degree of excitement as pornographic material will create disparity with reality. And lastly, that desensitization will constantly require for more, and that itself will play out that fantasy and sometimes might hurt the individual or other people. Although pornographic addiction is something that is widely debated, but people who really suffer from this, or the couples or relationships suffer from this, when they need help, there are other ways, or there are multitude of ways to help. First of all, there's cognitive behavior. So this cognitive behavior, in order to have individual with insight and recognition of their problems and eventually slowly dissociate from such addiction. Other way of treating this may be medications in order to suppress that compulsive desire. So in the spirit of the end of the year and Christmas, we're going to talk about other things that can actually enhance pleasure. And we're going to talk about sex toys. So if you are thinking about it, or you are wondering what this is all about, why don't you stay tuned for next week's Putting Dr. G on the Spot.